Hello, and welcome to Coffee with the Commission. Today, we're going to be discussing the 2022 legislative session and what to keep an eye on. Joining us today, we have WMC Deputy Executive and Legislative Director, Micah Matthews. Micah will provide a brief introduction, and then we're going to use the rest of our time to answer your questions. Please raise your hand using the raise hand function. And if you have a question, I will unmute you. You can also write your question in the chat box, and I can ask them on your behalf. And just so everyone understands, we cannot discuss specific licensing applications, open cases, and ongoing investigations in this forum. So with all of that out of the way, I will turn it over to Micah.
Thanks, Jimmy. So thank you for joining us on this particular Coffee with the Commission. This is, I guess, a two-part series. We always do one now in the beginning of legislative session and a wrap-up at the end. My colleague Stephanie Mason, who is not with us today, will be doing the wrap-up. As obvious, I'll be doing the introduction. So first off, the WMC does have a fairly active legislative agenda. Typically, in most years, in this year, we've actually intended to not have much going on, which is convenient because there's quite a few things that pop up that impact the commission as far as potential regulation to take on, or changes in how we regulate, or reviews of how we regulate. So for those who are unaware, the medical commission licenses and regulates physicians and all physicians assistants in the state. And so there's a process of assessment. If you're familiar with the legislative process, you can pre-file bills starting in December. And so far there's quite a few that have been pre-filed. And so we will typically go through and look at those and see if there's anything of interest that impacts the Medical Practice Act or impacts the practice of MDs and PAs. And so that's generally prior to the start of legislative session. It's kind of informal. We just kind of check it as we go through the holidays because there's nothing really to be done except to look and see if there's an impact. Taking positions is a little bit of a different discussion as far as taking positions on bills, and so I'll get to that in a moment. So typically, Medical Commission will follow or join the process of the Department of Health with respect to reviewing and assessing bills and determining what their impacts are. It's a sort of a mutually beneficial thing. We get a lot of good feedback from the department, and then we are able to give some good feedback to them. There's also a parallel track for board and commission members to participate in weekly calls with the department to give their clinical opinions about bills of interest that may be popping up. And so those are phone calls that happen every Wednesday morning, and each board and commission gets two representatives to sort of review what the agenda is and pipe in and decide what, and basically just give their opinion on if it would impact clinical care. So those are usually pretty rowdy sessions. There's a lot of back and forth about certain bills. Some are very favorable, some are not very favorable. So it's just one of those, another item to get more eyes on bills and get more feedback. Because the more feedback we get, the better we are able to anticipate impacts and changes. So with respect to the assessment process of bills, we always start off every morning by looking at the daily introductions and trying to determine if there's any impacts there. And if there is something of impact, we will typically get something assigned to us from the Department of Health, and we will do an analysis to see just how much does it impact us. And then that process will go through, and there's a health systems quality assurance review, and they sort of determine where they want to stand as far as a bill. And then it goes up to the agency where Dr. Shaw and his group, and we participate in that, and the agency tends to take a stand. Notably, it is allowable for the commission to take a position different than the department, but we are obliged to make sure that we have had plenty of conversations with my counterparts in the department to make sure that we try and work out any differences of opinion before we go public. And that's just not only is it required in our joint operating agreement, but it's also just common courtesy. So we try and make sure that we are observing the niceties when we're going through all this process, because legislation is all about relationships, really. So taking positions. The Medical Commission has a pretty standardized process of how we take positions on bills. If the bill in question is somehow impacting our statutory authority or anything like that, it's pretty easy to take a position on that of how it will, because our position is really how it will impact us, not if we have a pro or a con position on it. Outside of that, if the commission has existing rules, policies, guidelines, interpretive statements, or procedures, that really sets the course for Stephanie and myself as far as what we would weigh in on and what our position would be. If a bill addresses an area that impacts the commission where there are not any of those things, laws, rules, policies, or guidelines, then we would consult. We have a commission legislative panel consisting of our immediate past chair, our current chair, and then several other folks who are clinicians and public members. And we run the legislation by them and see what their thoughts are. They kind of guide us on whether we should be taking a position and what position that should be. I also provide, Stephanie also provides a weekly running update to that group just to let them know what is going on in the ledge session. And then in our business meetings every 6 weeks, I generally provide a report to the commission just to let them know where we're at, with the understanding that absolutely everything is fluid as far as what the statuses are, and likely if I write it down, it will be out of date by the next day. So just letting them know that. So that's our process generally about how we assess and respond to legislation. Now on to the updates. So an update from last session is what we've now called the MDCE or MD Clinical Experience License. From the 2021 session, that was House Bill 1129. It required us, the Medical Commission, to create a license to allow international medical graduates to get clinical experience in preparation for applying to a residency. This is a long-standing, in the last, I think, 4 years, we've had a lot of IMG-related bills. So this was a big win for the IMG community, and we were happy to be able to support that and move it forward as far as its implementation. So the requirements are that the applicant was required to complete ECFMG certification, complete all of the U.S. medical licensing exam testing steps 1 through 3, and be sponsored by an appropriate entity like a healthcare institution or a clinic with 3 or more full-time physician practitioners, and then file a practice agreement for approval with the Medical Commission, which would be approved at the same time as the license. And so the license was launched in November 2021, and we've so far had 6 applicants, and we've issued 4 of those applicants. So we have seen some success with that, and obviously the sponsors were the quickest on the constituent sponsors were the quickest on the draw on applying for those licenses. So we have seen that up and running. We anticipate that the application will move from a online PDF paper application to a purely online application within a month or so. So that's the MDC update. Now on to bills that we're looking at. So the first one is a piece of request legislation from the Washington State Patrol about RAPBAC. And so for those who are not familiar, RAPBAC in a nutshell is a service that turns a required FBI fingerprint background check into sort of a subscription service. So if you're an applicant to the Medical Commission, an MD or a PA, and you are out of state, likely you're going to be asked to complete a fingerprint, because the only way we can do a background check on you is through the FBI fingerprint portal, as opposed to if you're in state, we can use the State Patrol, and we would be able to get some background there. So in the licensing process, you would complete that, but then after that, you typically, with an employer, are going, if you work at, say, a large institution or DSHS, or maybe even if you're getting credentialed at an insurance agency or through insurance, you're going to have to be fingerprinted again and again and again. And because MDs and PAs are so good about washing their hands, their fingerprints are not the greatest when it comes to trying to get those read. And so we typically do see repeats, and that takes a lot of time. There's a cost associated with it each time that it happens. And with all those fingerprints happening, you're funneling that through one office at the Washington State Patrol. And so in an effort to streamline and make that more efficient, so you would only have to get fingerprinted once, and then all of the folks after licensing would just simply have to subscribe to that fingerprint set to get results. And so that is what RAPBAC is in a nutshell. The appropriate entities could subscribe and get those updates, and so it eliminates the need for multiple rounds of fingerprinting for hospital credentialing, DSHS jobs, insurance credentialing, and any other purposes where a legitimate organization could require fingerprint for the practice of a licensee. So we're watching that one. We're not sure exactly when it's going to get introduced yet. Likely it will be after legislative session starts, but that is one that's out there. The next one that was a little bit of a surprise to us was an update from a Sunrise review that happened this year on the creation of the profession of anesthesiologist assistant. And so that's just like it sounds. It's a sort of a mid-level provider that's similar to a CRNA or a PA that works with anesthesiologists, and they assist in inducing anesthesia and dealing with that. So there's a Sunrise review. The Department of Health hasn't finalized their report yet, but generally the recommendation was yes, it does need to be licensed if they are to practice here. There is a significant safety risk because they deal with up to general anesthesia, and so the proposal is that the medical commission would be the ones regulating that particular license because it operates very similar to a PA in that it has to have a supervision and a practice agreement, and they work directly with MDs. So it made sense to put that under the medical commission. So that's the proposal. It's not a medical commission request piece of legislation. It is coming from, I believe, the Anesthesiology Society, the Washington State Society for Anesthesiologists. And so that's the profession, and they're wanting to move that forward. At this point, the medical commission is supportive of the updated bill, and we'll see where it goes. So the next area of focus that we watch is scope expansions and scope restrictions generally. And at this point, we're aware of at least one bill that's going forward, and that is looking at the practice of optometry. That again was a Sunrise review process this summer. There were several comments pro and for this particular scope expansion. I believe the department is putting out a report that supports in part the proposal from the profession. The medical commission put forward a letter that expressed quite a few concerns about this with respect to the lack or apparent lack of training for doing certain procedures in comparison with ophthalmologists who do these same procedures. So there's a scope expansion attempt by the optometrists, and so generally we're trying to stay out of those unless we see some significant patient safety concerns. And in this case, there was not a lot of talk about what the specific training was, and how that would be accomplished in comparison with how ophthalmologists get trained. So that we will definitely be watching that closely. And then finally, there is a commission membership change bill that impacts all boards and commissions. This is a request from the governor's office, and it removes the U.S. citizenship requirements to serve on boards and commissions for health boards and commissions. It still maintains the residency requirements, so you have to be a Washington resident, but you don't necessarily have to be a U.S. citizen in order to serve on those boards. So that's an equity move, and we are generally supportive of that. We are certainly watching the bill vehicle that's carrying that forward, because it does seem to have quite a few other things in the bill aside from that. So that is an area of concern that we're watching. Other than that, we're seeing quite a few things introduced in the pre-files, if you're following that. A lot of focus on the long-term care insurance and trust, a lot of focus on insulin affordability and prescription drug affordability. So that's always interesting to watch. And then we've also, just this morning, I noticed that there was the creation of a student loan for a state student loan program. So that should be interesting to see how that plays out. As someone who had to take on student loans, I'm always very interested in watching how that works. So other than that, that is really all we're looking at this year. We may look at, in the next legislative session, some recommendations and changes based off of an audit from the state auditor's office that looks at our licensing disciplinary processes. So we're excited to see where that goes and see what recommendations for efficiency they can come up with. As ever, there's the Helms or the IT database system replacement that is ongoing. That should be completed in 2023, and that could also impact the audit results that are coming forward. And then we will also likely have a budget request where we're asking for additional spending authority, not additional money or fees or anything, just spending authority to cover some staff changes that have occurred as a result of both growing numbers of license applications and licenses issued, as well as some changes to the way we've had to do business due to COVID and working primarily from home. And so we're looking at how to address those things, and we will likely see a budget request next year to address some of those things. So other than that, that's really all I've got, and that's what our legislative process looks like. And those are the things that we're watching. Any questions?
Thanks, Micah. So if you have a question, feel free to raise your hand. I will unmute you, or you can type in your questions. I'll give everyone a second to do that. So.
It's always encouraging when you get done at the end of your presentation. You've answered all the questions because you were so comprehensive.
Well, that's exactly what happened. Well, I don't see any questions. I don't see any hand raised. So I just want to thank everyone for attending. This recording will be available on our website within the next few days. And I encourage you to share it with your circles and reach out to us if you have any questions. So thank you, Micah. And on behalf of all of us at WMC, thank you and take care.
Thank you.